Perfect. Does anybody else have any other questions? Okay, so as I mentioned, we're going to show a brief video and then we will take a few minutes break before we start our 9 a.m. panel. So we have Amaris Knight from the Nevada Institute for Children's Research and Policy, and also from the Nevada Coalition for Suicide Prevention, which she chairs. And then we have Misty Von Allen, who's from the Nevada Office of Suicide Prevention. And together they are going to talk a little bit about some of the efforts that are going on in Nevada and maybe some ways that we can all get involved to make sure that we try our best not to lose any more of our precious youth to suicide. So welcome both of you, and thank you so much for taking your time to be with us this morning. So if you each want to kind of introduce yourselves and just talk a little bit about the topic and what your focus is.
I guess I will I will go first since Misty's still on mute. Hi, Misty. Like Amanda mentioned, my name is Amaris Knight, and I am the current chair of the Nevada Coalition for Suicide Prevention. I am also a public health researcher in suicidology, as well as a childhood suicide attempt survivor. And so, you know, one of the things that is lacking in suicide prevention as a whole is the topic of lived experience and providing people with, you know, some of that background of like, this is what's really going through a person's mind at all different stages. You know, not just what the research says, but what the people feel that have lived through it. And so, you know, one of my roles is to really lift up that voice in the conversation. But overall, the Nevada Coalition for Suicide Prevention is a completely volunteer coalition that is all over the state, and we welcome anyone and everyone with an interest in preventing suicide for all different populations. We don't just focus on youth, but we also work with veterans and current, you know, people in the military, as well as elder suicide, the LGBTQ plus population, our indigenous and tribal affiliated individuals throughout the state. And so we are here to provide community training to people to help them recognize, you know, the warning signs of suicide, what to do about it, how to talk to people, as well as advocate for really important suicide prevention efforts and initiatives throughout the state. We work with a variety of community coalitions and organizations and have annual events that help raise awareness and lift the profile of suicide prevention, such as our Walk in Memory, Walk for Hope, that happens every September. And every other year, being this year is our next one, a statewide suicide prevention conference where we bring in researchers and experts from all over the country to help all of us in Nevada really learn what is cutting edge in this field and how we can be a part of it. So we are happy to be here and talk with you all today. We're so excited that there's so many of you on the call. And with that, I will pass it over to Misty.
And I apologize. Of course, right when I get on the phone starts ringing. So I thought I had it turned off. Good morning, everyone. I'm Misty Allen with the Suicide Prevention Office of Suicide Prevention, and I've been doing this work since Can I go set that off, you guys?
And I will jump in for Misty while she's out of the desk, just to let you know that she's our state suicide prevention coordinator with the statewide office in the Division of Public and Behavioral Health. And she is amazing at what she does and making sure that suicide prevention is at the forefront of, you know, health and public health efforts throughout the state. And so I'll let her talk about herself now.
You're very kind. Amaris is such a great leader, and her lived experience is really informative for all of our work. So the Office of Suicide Prevention is a lifespan mission and vision. We are currently drafting our new state strategy any day now. You know, it's never enough. We can never put the pen down because there's so much to still do. But we're trying to take the focus from what we've been doing is kind of chasing crises. A community has an issue and we go there. We have a very little resources. So we are kind of driven by that, and we need to stop doing that. 2001 was the first national strategy for suicide prevention and the call to action in 1999, and suicide rates have risen 36% since that call to action. So we're doing things that aren't working. And the office is trying to take things to a more comprehensive scale now. And so I hope you'll find our new strategy addresses many of these needs. Absolutely, we work with our veterans, the schools. We have a Project Aware grant coming out with the Department of Education that's very exciting for the next 5 years. Really focusing, our role is to focus on school staff, families, and youth, help youth become peer support. So I think that school-based mental health can be a really important game changer here for our young people. We also focus on service members, veterans, and their families, and really trying to build connectedness, access to care, and things like that. We have an office in Las Vegas with Richard Egan, who's training and assist today, and an office in Reno, and we just partner with community coalitions to help them build localized strategies. We partner with hospitals with Zero Suicide, an incredible initiative with Sherilyn Rahr-Wood. We knew we were missing many people falling through the cracks in the safety net, but one place people were turning up was in hospitals, emergency departments, and primary care, and they were falling through the cracks there. 70% of people who took their life had seen their primary care physician or healthcare facility within a month of their suicide death. So the Zero Suicide initiative is really making from top down, middle out, suicide safer care across the board. And I think I'll just leave it there because there's so much happening, and open it up to questions.
So before I jump in with questions, I just want to see, does anybody who is on the call have questions that they would like to ask? Again, we welcome your participation.
Hi, my name is Bridget. I'm a life coach. I do have a question. I understand that we have the suicide prevention lines for individuals to be able to call in and things like that. And I've often wondered, because I recently relocated here from Oregon, and I was working with someone who answers the calls for suicide prevention, and that person was having suicidal ideations herself. So I was wondering, what type of services do you all provide for those who take these calls? I often say, even coaches need coaching too, So do we have someone to help them? Because myself being an empath, that's a lot that we take in, and I often concern myself with, how they cope and how they're being supported.
That's a great question, Bridget. I started on the hotline way back in the 90s, and that self-care is so important. One of the biggest parts of my job was to monitor the volunteers who answer it, because it is tremendously taxing. And if you're doing that 8 hours a day, absolutely. The hotline, they have support systems internally for self-care. I know not just for hotline providers, but first responders right now, healthcare providers are really struggling with the pressures of COVID and the demands on their time. So at the beginning, we got some CARES relief funding to develop a warm line for healthcare providers with UNLV. And we wanted to try and foster a culture for the caregivers, right? So it's answered by physicians. And I don't know if it's overly utilized. I think there's still a stigma for certain frontline workers, law enforcement, first responders, but also there's the Peer Support Network. It's a website, incredible options for any frontline workers, nurses, hotline workers, law enforcement, firefighters, to seek help as well. So I think be aware of the resources and connect them. If they don't feel they have a place to go within their work, They could always call the Office of Suicide Prevention too for some support and connection to other resources. There's the Resiliency Ambassadors, if anyone's heard of the Resiliency Project. They're out there. They were set up to establish support for COVID diagnoses or resource challenges due to COVID. But as that starts to slow down, I think they'd be a great option for our caregivers and helpers to get support right now. So they are a phone call away as well if you go to Nevada 211. And I just say keep trying to find that help. That person who's just there to listen makes all the difference.
Thank you. I appreciate that. I too am a peer wellness specialist. With that being said, again, being here in the state of Nevada, is there a number or something that a person can call for peer support, for the peer support specialist? Because I heard you mention that. I'm sorry.
So there's several numbers I'll send to Amanda to send out. Specific to peer support specialists, the NAMI Warm Line is an excellent resource run by peers with lived experience. I think that can be very powerful. And the beauty about the NAMI Warm Line is they will call out. They're really there to help with the isolation and loneliness or chronic challenges. And so they might schedule, we're going to check in once a week, or maybe that person needs 3 times a week. So that would be a good option. And then I recommend the Peer Support Network. That website has some incredible resources and mental health professionals that are focused on those first responders. And I kind of consider hotline workers first responders. It might be a little different, but you know, you're in that acute moment. So I'm going to put my cell phone in the chat if anyone wants to talk further or get more information.
You're awesome. Thank you, Misty.
Great question, Bridget. Thanks for what you do.
And to help out with those, there's some links popping up in the chat for you guys as well with the Peer Support Network website and the Nevada Resilience Project links. That'll take you straight there as well, and hopefully that is helpful for you guys.
Perfect, great. And we'll get some of those on the website too, so that way they're there for future reference. And I see Dr. Underwood, thank you for joining us again today. You have a question?
Yes, I had a question. My question is, how, Misty, do you feel that or first I should introduce myself. I'm Medica Underwood. I'm with UNLV School of Medicine, the Pediatrics Residency Program. And so I had a question regarding how you felt the advent of the mobile crisis and the utilization of that within our clinics has either mitigated some of this or, you know, in what areas that can be bolstered.
I love the mobile crisis when it came up a few years ago. I think it was so incredibly important, diverting youth and their families away from emergency departments, which aren't set up for these crises. They really aren't. And the beauty of the mobile crisis, when they are fully resourced and 24/7, they allow that family to get services to stabilize. You know, we could take that child and keep them safe, maybe get them some treatment, but eventually they come back to that home and that environment. And so we have to make sure that that family is part of that, as you're well aware, with that stabilization. And so I think in the rural communities, it's been harder because of vast distance for our mobile crisis teams, but they've been able to pull out the telemedicine and start. I think with COVID, that's been a silver lining. We're getting more acclimated to this kind of conversation over telemedicine. And I think that's hugely important, especially if there's transportation issues for those families. I know that mobile crisis will keep growing as we start to build our crisis system around the state. I don't know how many of you know that the hub, the air traffic control kind of hotline, mobile crisis 24/7, and then stabilization units, so that they're getting the least restrictive care with peers and recovery focus, zero suicide principles that will be much safer and less traumatic for the youth and their families. So I really think that mobile crisis is fantastic, but that workforce is difficult to maintain. It's a demanding job, and as you know, we have shortages in that workforce. But if we can keep building that, I think it's life-saving for those families and youth. I hope that answered your question.
Yeah, definitely. I think, I've seen that in multiple settings where either even in the hospital setting, in the emergency room, they utilize mobile crisis. And so the unit will come to the hospitals and interview the families and the patients, as well as in our clinics when we've had some concerns. I think one thing that's sometimes been concerning is in the hospital setting, it seems like they're able to, like you said, save or protect those kids a little bit more. In the clinics, what I've seen sometimes is, children that I'm extremely worried about, and I've called them and kept both the mother or the father and the child there, even after hours sometime for a mobile crisis to come. And then they have this, I guess, this consent sort of where they call the parents and they say, is it okay? And sometimes what I'm seeing is the parents, well, like, not now, not today, maybe another day. And I'm kind of wondering what else can we do in, those situations where we are calling for help and maybe some of those kids are still slipping through the cracks. As you said, there still are a high number of children who are seeing their providers within a short period and still committing suicide.
Yeah, the family has to be a part of that safety planning. And I think there's an opportunity for family education. I know it doesn't always work. We do school screenings, and we have to call the family if there's thoughts of suicide. And it's such a scary conversation. So it's really working with that family. And I know this is scary, but we're going to help you keep your daughter and son safe. I think shifting that for the family, knowing that they have supports too in this process, can be huge. We're trying to build into the plan a post-vention initiative. Typically post-vention for suicide been after a loss, but I really want it to be after an attempt or ideation where we go into the hospital. It's going to be a huge endeavor to try and build, but go into the hospital and support those families like you would with grief and loss or other trauma, and help them be that safety planning support system, give them the tools so that it's not as scary. I think we all hear suicide and it's just so frightening. We want them in the most restrictive place to keep them safe. But we have to help them build that empowerment and coping even as youth, because this might be a lifelong journey for them. And the more resiliency we help them build and that family, the safer they will be. But it's never 100%, right? It's a tricky one.
That answered my question. Thank you. Yeah, that sounds wonderful. I think that's so important.
I'd love to talk more, Dr. Lewis, about that.
Yeah, definitely. Thank you.
Thank you.
Thank you. It
That's
looks
very
like
long-winded.
we have Shelby, welcome from Boys Town, Nevada. If you want to ask your question or have a comment.
Yeah, I have kind of a question. So I'm curious on the radar for the Suicide Prevention Coalition, if there's any conversation around supports for families that are dealing with children or adults with psychosis, right? And knowing that psychosis is an element of a different type of diagnosis, oftentimes with like schizophrenia or bipolar disorder, but that specific characteristic of mental health is one that is, I think, really misunderstood, and there's not a lot of resources. And so in the fall, I had a family member who we dealt with this, and even with me being pretty well connected and understanding mental health and having utilized services, I had, and I'll just be very frank, a hell of a time finding anyone that could support that family member just to have a conversation, because the issue is there wasn't a safety concern, right? And so outside of that, no one was willing to just, with psychosis, right? Like, people don't recognize that they have a problem. And so it's really that family unit being a part of, and I understand there's like HIPAA and stuff when talking about, but there wasn't any resource. And I probably called, and I'm not exaggerating, like 15 different places, either individual counselors, behavioral health clinics, institutions, just to talk to someone to get insight, because it was the first time dealing with it and it was so unique and intense. So I'm curious, and I know that a lot of times those diagnoses lead to suicidal ideation and have a high rate of suicide attempt. So I'm curious the crossover, if there's conversation around that.
Yeah, I mean, it's definitely an important factor, as well as, so many other mental health indicators and conditions, because there is no Misty's gonna laugh at me. There's no one right path to suicide ideation. You know, it's not A plus B equals now I have thoughts of suicide. There are so many different paths that people can go on to get into that place and get out of that place. And there's so many contributing factors that, you know, to narrow down to one particular thing, sometimes never happens. You know, it's a mix of, you know, physical and emotional, you know, medical and health concerns. It's a, you know, part the environment, part your family, your support systems, those kinds of things. I can tell you, not just throughout Nevada, but other states as well, it is difficult finding people, even trained professionals who have been mental health coaches and counselors and psychiatrists for 30 years. It is difficult finding people who are comfortable talking about the aspect of suicide, especially in a patient, especially because they're worried about liability, which is a huge thing now with, you know, especially physicians and health insurance companies and everything. So I see it from both sides. But one of, you know, the goals for the coalition and so many of our partners is kind of, you know, destigmatizing and demystifying suicide as a whole, and getting people to understand, like, you know, you don't have to be scared of this word. It's okay to talk about it. You know, and the only way we're going to be able to do anything about it effectively is if we have the conversations. So, you know, for those who are dealing with some of these, you know, I don't know the right word, but the, you know, conjunctive conditions, the things that partner up that can eventually lead to suicide and suicidal thoughts and attempts, you know, the trainings that we offer and what we encourage people is to be comfortable asking the question, are you having thoughts of suicide? Do you have a plan if you are having thoughts? And then in asking that question, being ready to, you know, you personally asking that question don't have to become a counselor, but knowing who you can help guide that person to start on the journey of getting the help that they need on all different aspects. That's what we try to focus on for members of the community. Is that helpful?
Thank you.
And I'm sorry, I put some resources in that might not be effective, so I'll have to follow up on that. If they are working, they're incredible, especially for the 15 and up, when that first episode can be life-saving. But I know it comes and goes depending on resources. So thank you, Amanda, for highlighting that.
Yes, I've often tried to refer there as well. So that's it is one of the few resources that we know of that are specific for that. So it's but yeah, when it's active, it's fantastic. There's also another question in the chat that Anna posted. She was asking, how does social media play a part in suicide, and what resources might there be to assist with that?
A really great question. With COVID, even before COVID, we knew this was a challenge. The youth rates, as you know, are rising, and that started really taking a hockey stick angle about 2013, 2014, when really kids were getting active on social media. So if anyone has seen The Social Dilemma on Netflix, it's incredibly frightening, but I highly recommend it. We have to make sure we're monitoring our youth, getting them out in tangible other areas, not just on screen. For the longer their screen time, the higher the risk for suicide. And that could be multifaceted loneliness or other things before, but we have to get them grounded with other ways, especially with COVID. So make sure you're monitoring. And the other aspect of that is lack of sleep. So if they're on their social media late at night, that impacts their coping and resiliency. I have an intern with UNR Public Health who's researching this right now. We're trying to develop a training for families on not just social media, but technology in general, the screen time. I've heard of kids doing YouTube on one screen, playing a game on the other, and their class on a third screen. And you can imagine how it impacts the brain. So I'm hoping to focus on that training on suicide prevention and technology for parents. So hopefully we'll get some good information to share with you in the next few months. It's a great question.
Yeah, and I'll piggyback off of that, you know, with Missy in the sense that, you know, for so long, you know, pre-COVID, it was, oh, you kids are spending too much time on social media and it's bad, and like that was that, and they need to get off it. And we've seen that those who are, you know, connected to any kind of social network and support system throughout this pandemic, where they physically can't spend time outside their house or with other people, has been somewhat, it's had somewhat of a grounding effect where, you know, they can kind of be brought back into what is going on in the community around them and with their friends. On the flip side of that, I put a link in the chat to recommendations for responsible reporting about suicide. So for those of you who are professionals and, you know, you run the social media accounts for your organization, or you just want to make sure that what you're posting is not triggering in any way, or, you know, providing false information or false ideas about what's going on, the American Association of Suicidology has some great resources, both for social media, for print, newspaper media, recorded visual media as well. And so I would highly recommend that. So if you want to raise that conversation on social media platforms, please, by all means, you know, do it. It's important, like I said, that we talk about it, as long as we're talking about it responsibly.
I saw in the chat a comment about kids not wanting to talk about their thoughts for being stigmatized or judged or sent away. I think that's really valid. I have 2 teenagers and they've grown up with suicide in their life, suicide prevention in their life. It's commonplace in the conversation. And if we overreact every time they start to have this conversation, that's really detrimental. And it's terribly commonplace. So I'm starting to just listen. Help me understand why you're talking about this in this way, be it social media or face-to-face, that they toss that word around, and we just have to go in and find out what that's about, what's behind the discussion. Is it just how they're talking with their friends, or are they struggling with thoughts?
Yeah, and you know, a big part of that too is as the adults, I put that in parentheses for myself, but as the adults in the room, you know, we also have to be cognizant about how we're talking about our feelings and our emotions and our struggles around kids, no matter how, you know, whether they're infants or 18 or, you know, even, you know, grown children, because they're going to, you know, make their own connections with your words. And so if your lexicon is full of, you know, just popular idioms like, oh, if I don't get this new sneaker that comes out, I'm going to kill myself. Or, you know, if I fail this one test, like, that's it, my life is over. And though internally we may know for ourselves, like, well, I don't actually really mean that. Kids, especially younger kids, they can't really make that distinction. And so they may feel that that's an appropriate response to these negative things that are going on in their life. And so, you know, it's on us as well to make sure that we're kind of checking in with ourselves when we speak and when we write, to make sure that, you know, our messages can't be confused.
Thanks, Amaris, for that insight. It's a great tip. Anna, I see that you have your hand raised. Did you have a question or a comment?
Yeah, I have a question. How has suicide affected Latino and Latina families here in Nevada? Is that data that we have?
Yes, I know a few years back we were, even nationally, not just Nevada, Latina young women were incredibly at risk for suicide attempts. And we would hold town halls, and the stigma was profound. It's very difficult even to walk in the room for the Latino families. So we have partners up here with Children's Cabinet and Dr. Steve Nicholas, who have developed, they went in and had focus groups and conversations with Latinx youth and their parents, because you're probably coming from two different parts of this conversation. And they've developed a training that's called Living Ideation, and they're just starting to build it out because they didn't want to have that barrier between the generations and this mental health stigma and suicide stigma. And it really starts with checking in on life and that connectedness. How are you doing today? And just starting that conversation. And if the conversation is hitting walls or you're starting to feel this isn't going well, we move into the more direct suicide conversation. You know, we've always trained ask directly, get in there, but that doesn't work for all cultures. And we have to be cognizant of opening that door in a safe way for both the kids and families. So I think it's a great question. We need to pay more attention to it, especially in times of COVID with the resources challenged, to have different ways to have this conversation. So check out Children's Cabinet and Living Ideation. They've been taking it to the schools for school staff and families, and we hope to grow that.
Yeah,
Go
and
ahead, Amanda.
I was just going to say, you know, the coalition, for a while, like I mentioned, we do, you know, quite a few community trainings, and some of those are available in Spanish. We do have trainers fluent in Spanish and from, you know, Spanish cultural communities and ethnic heritages that are able to provide these trainings. But historically, what we found is that there are not enough members of the community willing to, you know, sign up for this training where they'll be sitting in public learning about mental health and suicide, even if it isn't, you know, for themselves, but, you know, like a mental health first aid training where it's all about, here's how you can help other people. The topic is so, you know, not necessarily taboo, but well, I mean, yeah, maybe that is the right word for it. Like we're just not going to talk about that. Yeah, we know it's there, but it's okay. And so one of our goals is to, you know, kind of get out of this thinking of like, well, here are these 3 trainings we do, and we're going to offer it. If no one wants to take it, then that's on them. And expand that out into like what Misty was talking about, and figuring out, well, what's going to work best for this community? You know, how can we partner with them to, you know, develop and review and contribute to some of the content and material that we want to provide for them so that it is helpful and culturally relevant and well received.
And if I might add, recently in December, we did a BIPOC town hall specific for suicide prevention down in Las Vegas. And it's the beginning, just the beginning of a long, long conversation. But it was represented with Black faith leaders, Latino community leaders, and we definitely have gaps there in that panel. But please listen to it. It discusses some of these challenges and barriers that we have been missing as an Office of Suicide Prevention, without a doubt. We want to be better, but it's a long conversation, and we have to just get in there in the communities and learn, for sure. But if we can find that link, I think that's a really valuable conversation to listen to.
Absolutely. Thank you for bringing that up. And I think I do have a link to that video, so we'll make sure that we send that out in those resources as well. And I think that's a nice segue. I wanted to ask, you know, sometimes when people are at their lowest and they're having those thoughts, and you know, when you're in that moment, you may have access to different resources, for lack of a better word, that will actually, you know, facilitate your attempt. So I know that I think the office in the state had done some work in order to reduce access specifically to lethal means, to make sure that, you know, individuals have a chance to recover from those thoughts, and that if they don't have access to those means, that, you know, that could have a better chance at the recovery and not following through with an attempt. So could you talk a little bit about those efforts and how that works?
Absolutely, and I think those links are on our website. I would love you to watch the PSA. We put a lot of thought into the safety. 70% of people who attempt suicide did it from under an hour from the triggering event. 25% who had near fatal attempts, less than 5 minutes. Especially youth who have that impulsivity more so. They might have a fight walking home, and there's the medication of firearms. So one of the few proven prevention strategies is lethal means safety. Gun locks, gun safe, medication safe. And it's not a political issue. It is an injury prevention issue. So our mobile crisis team, we got CARES funding in December. You can get gun locks, medication safes, and doTERRA bags for medication dissolving from our mobile crisis. If you know someone who's worried about a use or anyone, or they've had a post-attempt and they're in recovery, we want to make sure everything's locked up. The PSAs are really twofold. They show the youth struggling, but they also show the youth realizing this was a hard time. So it shows recovery, they get through the hard time, and then building connection with the parents, and then also locking up the gun. So that is such an important thing families can do immediately. It can make a huge difference because people don't typically stay in that suicide crisis. There are chronic suicide, situations, but often it's acute, and if they can keep themselves safe and can't get that method, either they're intervened upon, they have time to reach out, or they de-escalate. So I'm sure you have something to add, Amaris.
Yeah, there was a question in the chat, asking what the leading methods of, suicide, especially attempt, are that we should be aware of. And Misty really highlighted the two, especially for youth in Nevada, that are the most troubling right now, which is access to firearms and access to medications. And it's not about, taking things away from people. It's not about making things more difficult. It's really just about safety. And the same thing you'll learn in your general, child abuse and neglect prevention classes. You want to make sure that whatever is in the home that could facilitate an attempt is stored safely, out of the access of young children, older children, anyone in that household that might be experiencing mental distress. And it's okay, to, especially with firearms, to provide those to a trusted individual outside of the household to hold on to it for a little bit. In the event that, there are some turbulent times happening, just to be on the safe side. And so for injury prevention as a whole, those are the two that, really are individually the most easy to tackle, because you can take care of that in the next few minutes, just looking at your house, making sure things are stored safely. One of the things that the coalition does when we have outreach events that happen in the community before and hopefully after COVID is we provide free gun locks. And often are able to, either raffle or, provide for different organizations like full gun safes, to let and show people how to use them, to let people know, like, this is an easy thing you can do to ensure the safety of your family. And so we hope to continue doing that as we can get back out into in-person events and tabling opportunities.
I will add to that. Several years ago, we had a really intense effort working with gun shops and gun shows. Our typical rate of suicide by firearm is 57%. I think right now we're in the 60% because so much is out there. We've got it down to 51%, almost 51%, which is the national average, because the intense efforts. But then we had a lot of mass violence events, and it became a difficult conversation with our firearm partners. And so when you stop that comprehensive prevention, the rates will go up.
Perfect. Does anybody else have any other questions? So we'll just ask too, what are some of the main, the top two things that you want policymakers to know about youth suicide prevention and what is needed in our community for us to be more successful?
Oh, I think the number one is a strong crisis system, helping people in the least restrictive area, in the community. Destigmatizing crises and suicide will be life-saving, but we need that system built. We can't keep sending everyone to the hospital, emergency department, and funding for mental health and public health. We really have to get it there. States with good support have lower rates of suicide, and those resources are crucial. So those would be my two thoughts.
Yeah, I will wholeheartedly agree with Misty, especially on, the funding issue where, almost all of us that are here on this call right now are in the prevention world in some way, shape, or form. And we know that, getting into any type of issue at the very, very beginning, as upstream as possible, and focusing on preventative efforts will lead to much greater outcomes later on, because you won't have to spend as much money on things like treatment and postvention and acute crisis intervention if you're able to provide the supports and resources and funding to early prevention efforts that can take place, as early as preschool in the schools with, evidence-based programs and curriculums and curricula, and ways of teaching, and within community organizations. That is, I think, one of those things that we at the coalition would love to see more of in the state is, funding and support for those upstream efforts in all different communities. It is crucial to ensure that we have the money saved then to build out the infrastructure for, our crisis needs, our postvention, our treatment, our residential treatments, investing in prevention as early as possible with as many people as possible will allow us as a state and as a community to have the funds and the resources and the workforce to provide, those postvention and treatment opportunities that are needed, because we'll have less people needing those because of our strong prevention efforts.
Absolutely. Thank you both. And, just to add a little bit too, we have some great training resources in our community. And the more people I think that understand how to recognize some of the signs, the early signs of when youth may be struggling, may be great times to start that intervention before, again, it gets to a place where it leads to suicidal ideation and something more serious. And those signs can look different in youth. And oftentimes, hindsight is 20/20, right? Looking back saying, oh, now I understand why my kid was angry. I thought they were just, they were upset. They didn't look sad. They didn't look depressed. And sometimes we're looking for, our thoughts of what something might look like or signs of trouble may look like don't match with what the youth is actually displaying. So the more that we can help parents understand that and get those conversations open can help get access to those early resources, even just starting the conversations, right? Having youth that are able to talk about it with their parents or their friends. Bridget brought up yesterday a great point that, it just takes one person, right, to connect to, that youth can feel like they can talk to and they can go to for support, that can really save that child's life in a number of ways. So the more that we can get that out there would be wonderful. And I see that Chris in the chat box, and Ameris, that's how you responded to him, but as a father, how can we get involved in making sure that they have an avenue for that and know how they can help support the community. So how can individuals on the call get involved if they want?
Can I just highlight one quick thing? You mentioned what to look for. We always talk about the signs, those invitations for help, but in this time of COVID, assume people are struggling. If it's not them, it's someone they're close to. And so checking in and just saying, how are you doing today? It's been a tough week. I think as long as people know they're not alone, it goes a long way of getting that pain and loss out there into the world and get support. So Ameris, I know you have a lot to say on the question.
Yeah, no, you're 100% right with that. And, as many of you on the call, are parents or you work closely with kids, I cannot stress this any more than just saying, talk to your kids, not at them, but talk with them, have conversations. They not only need to know that, oh, yeah, my dad's there and I can talk to him and that's cool, but he understands what I'm going through, that, you know, the strong face that parents like to put on sometimes, and not be emotionally vulnerable to their own children makes it really difficult for kids to open up to their parents, to be honest with you. So, you know, having those conversations, letting them know, like, you know, yeah, I want you to tell me your feelings. It's okay, talk about it. You know, they're only going to feel comfortable doing that if you also talk about your feelings with them too. So having those conversations is really important, and will allow you to better understand, you know, the unique aspects of your own kid that, you know, if they get into any kind of, you know, severe depression or are considering attempts, you'll be able to notice those changes in behavior, those prolonged changes in behavior, a lot easier if you talk with them on a regular basis. I could go on all day. But as far as getting involved and what people can do, aside from checking out all of the amazing links and resources that people have been putting in the chat box this whole time, the Nevada Coalition for Suicide Prevention, like I mentioned earlier, is a completely volunteer coalition from almost 180 members from all over the states. We offer, you know, individual and organizational memberships if you'd like your, you know, your whole organization to be involved. And we welcome anyone with any kind of interest in suicide prevention or, you know, mental health awareness. There are plenty of committees that you can sit on, including, you know, outreach, communications, advocacy, finance and development, if that's your thing. We definitely welcome our finance and development people. But there are plenty of things to do. We have a conference planning committee that I need some help with. So if you'd like to plan a conference in October, we could definitely use you and your expertise and your hands. So there is a link in the chat to our Join Us page for the coalition. Please feel free to take a look if it's something that sparks your interest. If you have any questions or want to know more about what you can do or how to be involved, please feel free to email me and I will put my email in the chat box.
I love that Chris is all in. I can't wait to meet you, Chris. That's great.
Perfect. Well, we just have a few minutes left, so I want to see if anybody else has any last burning questions. And thank you. We have a comment from United Citizens Foundation. Oh, go ahead. Oh,
I'm sorry, Amanda. I'm sorry. I just have a question, and I won't take up too much time. But not even 8 months ago, my daughter tried to complete suicide. So, and I'm a mother of 8, a mom to many, and we have conversations. We talk about any and everything. Okay, my children and I, we were just that close. Okay, we're that close, and it's not self-proclaimed. This is things that they say to others. You know, no, I can talk to my mom about anything. However, I noticed the signs. I seen them. I seen what she was doing. I seen the change in her behavior. I noticed the whole totality of it. And never, ever did I pressure her. It was more of, babe, are you okay? You sure? Okay, whenever you're ready to talk about it, you know I'm here. Okay. And she was like, oh no, Mom, I know, and this, that, and I'm looking at her, I said, all right, you're lying, but okay, whenever you're ready, you know, we can talk, you know, because that's just how she and I, we go back and forth. So mind you, she did try to complete suicide right there in my home, all right, which led her to the hospital, which led them to keeping her in for 72 hours. Actually, they didn't even keep her for 72 hours. They kept her for 24 hours, and then they let her go, and then she tried again. Okay, yeah. So needless to say, once this whole thing blew over, I asked her, was there anything I could have done to make you change your mind or to see things differently? You know, was there anything I could have done? Because I believe in going to the source, all right? You're the one who's trying to complete it. I know when I tried to complete it years ago, a person pressuring me, are you okay? You sure you're okay? Bridget, now you know you can tell, okay, you know what? I'm just gonna go ahead and do it because you're getting on my nerves. Okay, you know, like that. But with my daughter, I asked her, you know, was there anything I could have done? You know, and why didn't you feel comfortable to talk to me about it? And her whole thing was, I didn't want to hurt you. And not only that, but she wasn't trying to complete suicide because of whatever. She just wanted the pain to stop. So she was trying to kill the pain, not necessarily herself. So again, Mom, there was nothing you could have done. Now, me going to that hospital, she said, and the way those people talk to people, and she's in the medical field. And she's like, the way they talk to us in there, you know, and then they send me over to the behavior place, Unity Hospital. And she's like, and the way they treat the people up in there, you know, she said, it's just horrible. And I'm like, you know, because so many people get super excited to know that they passed the interview and we have the job. And yes, you know, and then when you get up in there, it's totally different. And you go home and you're talking to your friends about it. And, you know, I had this one person up in there. Oh my God. They was like, really? Okay. So back to the original thing, because she tried to complete and I was trying to be supportive and be there for her. And I seen all the signs. That's what hurt me the most, because I seen all the signs. I seen the change in behavior. I did everything I could, and I spoke with different people. Is there anything I could have done? Whatever, she has to open up. I don't want to assume, and I don't want her to assume, her to feel that I'm assuming she's going to complete suicide, even though I know that's the road she was going down, you know? So yeah, she's the reason for my very first and only tattoo in my 50 years, you know? So what are you doing? Yeah, okay, yeah, for real. The completion, thank God that, you know, her story still continues. But what do you do in a case as such?
Thank you so much for sharing that. And I'm hoping she's doing well in her recovery. Amaris, I'm going to turn that one to you. Lived experience.
Thanks, Misty. You know, it is so true that people who attempt suicide, and I'm going to take a wild guess that I'm pretty sure is accurate, people who complete suicide, their main goal is not to die. They don't want to die. They do want the pain to stop. And the most critical part about that is they see no place, no outlet, no way for them to get past the moment that they're in. You know, whether there's a huge difference between saying, look, I found all of these links and resources and you can click on this website and talk to people. Go ahead, versus taking the time to sit down with them, you know, walk them through it, not like you need to do this, but, you know, to show them it's not so scary to reach out for help, and that there are people that are willing to talk and help with them. And, you know, if it's somebody that's in your family that you're close to and you are feeling overwhelmed or scared, it's okay to let them know that, because without that kind of connection, I can assure you firsthand, it will feel as though they have brought their problems to you. You say that, you can come and talk to me about anything. And you're like, okay, cool. I'm talking to you about this. And they're like, but no, like I can't. Here's a pamphlet. That in turn feels as if their problem is not worthy of your time and your attention, and that there really is no other way out, because I've read all the pamphlets, I've gone to the websites, and it's not connecting with me. And so really taking, the initiative to say, I get what you're going through right now is a really scary time and that you're in a lot of pain. I don't feel like I'm the best person that can help coach you through it, but here, together, let's work on finding somebody who can. And I am going to hold your hand. I'm going to support every single step of the way. And I'll be here for you with a shoulder to cry on, to give you pancakes in the morning if that's what you need. But, you know, not every problem I can tackle myself. Let's together go to the people that have the skills and the education and the experience to help you through this. And, you know, going back to the upstream prevention conversation we had a little bit ago, instilling the skills and those protective factors for youth as early as possible, helping them understand how they can cope with a negative life situation, whether that's the loss of a family member or, you know, the loss of their favorite colored pencil. Giving them the skills to know how to deal with that and react appropriately from as young as possible is one of the keys to, you know, helping them on a path to strength and resilience as they grow up.
All right, thank you so much for sharing. So it has been, it's been a great hour. I want to thank, it goes by fast, right? I want to thank you both for taking time out this morning to talk about this very important issue, and for everybody who's joining us today that also, you know, has a passion to protect our youth, and we want to make sure that they're that they feel supported emotionally through all of their good times and the bad times, through the whole package, right? So thank you for this. We've got a little bit of a break. I know Amaris will be on. Missy may stick around for a little bit. I'm not sure what her schedule is, but if you have other questions, you can continue to chat. I just want to put a reminder out there too. I'm going to. Great.